Hey Emma, I just watched your video about your research paper proposal. My name's Kelsey, by the way. Sorry, I didn't say that first. First of all, I just want to say thank you for being so open and sharing about your past and everything that you've been through. Second, congratulations on 4 years sober, clean. That's amazing. That's amazing. And third, we'll get to your review. I really love the topic that you chose about the most effective methods for detox treatment. Because I currently work in an MAT program. And of course, you always see patients who come in there who are not there for the right reasons, which, is the same thing for inpatient. In MAT, we struggle because we have a lot of patients who come in who just want Suboxone to either sell or give somebody or, abuse, shoot it up, whatever. So I understand where you're coming from, where you mentioned that patients have to be kind of screened for their motivation, whether they're really determined and motivated to complete treatment or if they're just there, like you said, for oil change to get it out of their system and go back to what they're doing. So I really enjoyed your video. And once again, thank you for being so open and honest about everything. It's amazing. So I found a article that is titled Counselor and Drug Detox Inpatient Verbal Behaviors in a Single Session of Motivational Interviewing and Subsequent Substance Use Related Patient Outcomes. It is by Ann H. Berman. So, as I was reading through it, it did talk about one of the challenges that you mentioned in your video about facing treatment provider, significant challenge that treatment providers face for problematic substance users is to mobilize the client's motivation and stimulate behavioral change within a short period of time. It is relevant with inpatient detoxification care when clients are in crisis and in treatment for several days. That's when the challenge is, the most. But the evidence suggests that receiving 3 motivational interviewing sessions increases the proportion of alcohol detoxification patients who participate in the 12-step groups 2 months later. And they're receiving sorry, I can't talk tonight apparently, receiving a single MI session, motivational interviewing session, positively affects drug detoxification patients 3 months later in terms of increased awareness of positive effects of drugs, as well as increased self-efficacy regarding the capacity to abstain from drugs in connection with positive feelings. So I really like this article. As I was reading through it, I had really good information. But good job on your post. Thank you for being so open. You did great. Thanks.